Here at the Surgical Cave Hill School of Business and Management, located at the University of the West Indies Cave Hill campus, we meet the needs of the upwardly mobile professionals. Our business school functions in an evolving global space where the need to have that competitive edge distinguishes you as a professional. Our academic curriculum offers a variety of programs that gives you that edge. We offer our students a doctorate in business administration. Then, there's our executive masters in business administration. Our Surgical Cave Hill School of Business and Management is for you. Enroll now.
Welcome to the Surgical Cave Hill School of Business and Management's webinar entitled Medicine and Management. My name is Marjorie Wharton, and I am the moderator for this discussion this evening. And we are expecting it to be an exciting one as we explore this topic of management and healthcare across the region. Following the impact of the COVID-19 pandemic, it has become even more evident that the effective management of healthcare and healthcare institutions is critical to the overall health and well-being of a nation. During this webinar, our panelists will discuss the key areas in healthcare management, critical management skills that healthcare professionals will need in the future, and the role of the school's new EMBA in healthcare management will play in helping you to build those skills and capabilities. Now, allow me please to introduce our panelists for this evening. We have Professor C. Justin Robinson. He is a National of St. Vincent and the Grenadines and currently serves as Head, Department of Economics at the University of the West Indies Cave Hill campus in Barbados. He obtained his PhD in finance from the University of Manchester in the United Kingdom. He also holds an MSc in finance and econometrics from Florida International University and a BSc in management studies with first-class honors from the UWI Cave Hill campus. Dr. Robinson's research interests are capital markets in developing countries, public finance, financial risk management, and corporate finance. Dr. Robinson currently serves as the director of the Central Bank of Barbados and first vice president of the Barbados Museum and Historical Society. Good evening to you, Dr. Robinson.
Good evening.
Thank you very much. Our second panelist is Dr. Kenneth Connell. He is an associate professor in clinical pharmacology at the Cave Hill campus, a member of the UWI's highest decision-making committee, the Senate, and a consultant physician at the Queen Elizabeth Hospital in Barbados. Dr. Connell is consultant in charge at the hospital's Resistant Hypertension Clinic. He is also a member of the QEH's Drug and Therapeutics Committee and chair of the Specially Authorized Drugs Committee. He sits on the Barbados Pharmacy Council as a representative of the Barbados Association of Medical Practitioners. He holds MBBS and DM internal medicine degrees from the University of the West Indies and a Doctor of Philosophy from King's College London. He is a fellow of the American College of Physicians and of the Royal College of Physicians and local chief examiner for the Royal College of Physicians MRCP examinations. Welcome to you, Dr. Connell.
Thank you.
You're very welcome. Our third panelist is Mrs. Juliette Bynoe-Sutherland. She is the executive chairman of the Queen Elizabeth Hospital. In this role, she chairs the board of directors and manages the operations of the National Hospital, isolation centers, and associated public-private service level agreements. She is an attorney at law, called to the Barbados Bar in 2006. She holds an MSc in Health Planning Policy and Finance with distinction from a joint program of the London School of Economics and Political Science and the London School of Hygiene and Tropical Medicine, as well as a Bachelor of Arts degree in History and Political Science with upper second class honors from the University of the West Indies. Her leadership has been primarily in the public health and health system strengthening arena and are undergirded by transcultural experiences as a research fellow in cancer and public health for the London School of Hygiene and Tropical Medicine, and in palliative care at the University College London Royal Free Hospital. Welcome to you, Mrs. Bynoe-Sutherland.
Thank you very much.
You're very welcome. Our fourth panelist is Dr. Madhuvanti, or Maddie Murphy. She is a senior lecturer in the Qualitative Research Methods at the George Allen Chronic Disease Research Center of the Caribbean Institute for Health Research, and the Deputy Dean for Research and Postgraduate Studies at the Faculty of Medical Sciences at the UWI Cave Hill campus. Dr. Murphy holds a Master's of Public Health from the University of Miami and a doctorate in Public Health Socio-Medical Sciences from Columbia University in New York. Her research and publications over the past 15 years have focused on social and behavioral determinants of health, public health policy development, implementation, and evaluation in small island developing states, as well as food and nutrition security intervention research throughout the CARICOM. Welcome to you, Dr. Murphy.
Thank you very much.
You're very welcome. Now, our webinar this evening is scheduled to run for an hour and a half, and we will start with opening remarks from our panelists. However, as we go forward, please know you can type your questions into the chat, and as we go along, our panelists will select and respond to as many of them as time allows. I'm going to now invite our panelists to start off with their opening comments. So, Professor Robinson, the floor is yours.
Thanks, Chair. Good evening. I was just checking on my mic there. Apparently, the most widely used expression for 2020 is "you are still on mute." So I was trying to make sure that didn't happen. It's turned out to be quite an interesting day. My first meeting this morning was with opening a session for the Regional Security Service, and now I'm ending the day with a session on medicine. Soldiers and doctors are groups of people that I tend to avoid, and so we'll see how this goes. Now, the Cave Hill School of Business has been in existence for 30 years, and we've offered management training to a diverse group of professionals across the Caribbean and internationally. As we were scanning the landscape and looking back at our graduates over the years, one of the professional groups that was conspicuously absent was the area of healthcare professionals, which really indicated a gaping hole in the professionals we were training. So we are here physically in Barbados right now. If you look at the annual estimates of revenue and expenditure for the Barbados government, the healthcare budget is consistently in excess of $1 billion. It's a major expenditure area. And when you add to that the amount of expenditure by private citizens on healthcare, and the last estimate I saw was somewhere in the vicinity of around 700 million. So healthcare services are clearly a major part of our society. And healthcare institutions and their effectiveness and efficiency is a critical aspect of our quality of life and our economic and social development. It is therefore critical in our view that these institutions, whether they be hospitals, pharmacies, polyclinics, and the full range of healthcare facilities, that the persons managing or running those institutions are exposed to and have a full grasp of cutting-edge management concepts. The way we understood the problem facing Barbados, the region, and many parts of the world is that in many cases, the healthcare institutions, their managerial posts are typically filled by healthcare professionals. These professionals are highly trained, highly skilled. They understand all of the nuances of the unique healthcare environment, but they're quite often not trained in the areas of management, human resource management, financial management, strategy, various aspects of logistics and supply chain management. Now, a number of healthcare institutions have in the past tried to address this deficit by bringing in trained managers, so to speak, the kind of person who typically does our EMBA. And as one senior healthcare person said to me, these persons come in and they think they're running a supermarket, when in fact the healthcare environment is a totally different and unique environment. I certainly remember as a grad student in a production operations management course, and we were doing some inventory models, and ended up with a group and we were doing inventory management for a blood bank. Now, when you're doing inventory management, normally you think of a lead time of a couple of days and things like that. Now, in the case of a blood bank, you simply can't have a lead time of a couple of days. So that there are many unique aspects to the healthcare environment that a manager that is trained in general management skills may not be fully aware of. And hence, we've not had the success we've expected in importing professional managers into the healthcare system. What this program aims to do is to provide management training to professionals who are already trained and have significant experience in the healthcare sector. So what we are aiming to produce from this program is a fusion of managers who are combining the latest management expertise with an understanding of the nuances of the healthcare environment. And we think this is critical if we are to get the maximum bang for our significant public spend on healthcare, that private individuals also are to get the bang for their buck from the significant amounts of money that they are also spending on healthcare. And we toss around these phrases, but in this is one case where your life could depend on it. Failure of management systems in the healthcare environment, again, literally can cost someone their life. It can have significant impact on their own personal quality of life, and by extension, their impact on as a productive citizen. So it gives me great pleasure to introduce this what we think is this important program, which seeks to fill a gap in our environment, and as we have a discussion around this topic this evening. Thank you.
Thank you very much, Professor Robinson, for starting us off, and certainly for setting the tone for why this is a program that is being offered and why it's happening now. Thank you very much. I'll now invite Dr. Connell to make his opening comments. Sir?
So thank you very much, Marjorie, and thank you, Prof, for opening. And I would like to say the second most commonly used phrase is actually, you need to unmute your mic in our new world. And so I'm really happy to be here this evening because I think it's such an important conversation for us to have as practitioners in the healthcare fraternity. And as healthcare practitioners, whether doctors, nurses, pharmacists, physiotherapists, we see the health landscape through a particular lens, which may not be the correct way of doing things. I'll use my own self, for example. My Monday morning, which usually starts quite hectically, started off with a university meeting. And then after the university meeting, I had some work to do at the Heart and Stroke Foundation. Then after that, I had a clinic, then preparing for a teaching tutorial later this week. All these things that seemingly are so distinct from each other. And interestingly, most of my training did not address any of them. And so as physicians, we enter into medicine, and the most commonly used phrase by medical students, why do you want to do medicine? I want to help people. Of course, medicine is not the only thing you can do to help people, but they generally do want to help people. And sometimes it's necessary to step back, look at the health landscape and ask yourself the why. What is your whole purpose? I'm sounding like a philosopher. What is your whole purpose in life? And yes, you have chosen to be a healthcare practitioner, but what is the landscape out there and how do you plan to interface with it? And I am going to posit that perhaps healthcare practitioners have certain domains that we all are behaving in. One is, of course, clinical care. I mean, that's kind of central to what we do. We are involved either in measurement, management or the analysis of clinical care. And it's hard to call yourself a healthcare practitioner unless you're practicing. The second part involves teaching. And this might be at the undergraduate level, it might be formal or informal, it might be you just teaching a junior member of your nursing team or your pharmacy team by mentorship, but there's some kind of teaching and training going on because it's largely an apprenticeship. We are trained for those two main roles. That's the clinical care as well as the teaching. But here's some other roles that are critically important in the health landscape that we're not trained for, and which I found myself going in on the deep end. One is leadership. How do you become physician leader, not just in healthcare? How do you kind of drive home those things that you think are important in health policy? I always encourage undergrads to start thinking about what's your beef about healthcare? What do you want to see our Caribbean landscape look like in the next 5 years that's vastly different from what it is now? What's your challenge? So that's how you're going to lead on that. Then there's advocacy, which involves some part of leadership as well. But what are you going to be the main advocate for? Most people on this call know that my passion is hypertension. And I'm very much involved in advocating for anything that will get blood pressure control rates a lot higher. But of course, childhood obesity influences this, and therefore anything that's related to the cause, as I put it, then I'm involved in it, advocacy. And then there's the management of HR. We may not realize this from the time you are an intern, you're managing people, or from the time you're a qualified nurse, you're managing nursing students. There's some kind of management that goes on. What are some of the softer skills that are so critical, like emotional intelligence, managing teams, managing disputes, dealing with difficult personalities, and how do you communicate effectively so that the team is a lot more coherent? Again, not part of formal training. And then another area is the health system. So a few weeks ago, I looked around the clinic, and as I usually do sometimes between patients, and I looked at ways where we were being inefficient. So for instance, I had to leave the clinic office to walk over to the main area to collect a patient to bring them back, which helps me cardiovascularly, of course, but it makes it more challenging because I could be doing something else like seeing another patient or discussing a case of a junior doctor, those kind of things. And I said to one of the SHOs, how do you think we can make the health system of this clinic run more efficiently? And of course, the look was, I was just going to ask you, what's the dose of X drug? I mean, why are you telling me about how the health system is going to work? But my position on this is we need to step back as practitioners and not see ourselves just as passive consumers of the healthcare system. In healthcare delivery, we have to have a role in shaping healthcare delivery. And my colleagues know this very well as well. Quite often we complain, managers don't understand us. But do we really understand them? And is that important? And if that is important, what are the steps that you can take to speak the language of management? And so the executive MBA and MPH program, I think is such a program. I wish I had done it about a decade ago because it would have saved me a lot of stress, a lot of sleepless nights, and it would have helped me to understand why, as a doctor, I am not really the chief cook and bottle washer on the medical team. I am simply another member of the healthcare delivery team. And so I'm excited to continue this discussion this evening. Thank you.
All right, thank you very much, Dr. Connell. Our third panelist I'm going to invite to make some opening comments will be Mrs. Bynoe-Sutherland. Please share your comments with us. The floor is yours.
Thank you very much, Marjorie. And I'd like to begin by saying I'm very, very excited for the University of the West Indies and for all of you who take advantage of this opportunity. In about 1997, 1998, when I graduated, I'm aging myself just then. I think I would have been the classmate of Justin's. When we graduated, there was no such program.
I'm way too young to be in your classmate.
We were, for those of us that had an interest in public health at that time, health services management, institutional care, there was no such opportunity for me. I had to embark on a course of study at two of Europe's leading schools. And even then, it took two distinct institutions to pull together one program, London School of Hygiene and Tropical Medicine and London School of Economics. So it was recognized then that you needed to have an interdisciplinary approach. And to see this evolving today to this initiative being mounted by the university, I think is signal, important, and very innovative. One of the things that would have been recognized at that time, I was one of the few non-clinicians, non-physicians in that class, was that the practice of medicine, the way it is organized, except for those who go into public health, tend to look, as Dr. Connell said, at issues from a very individualistic. They're concerned about the patient that is sitting in front of them and doing the best that they can as a physician for that patient. And the nature of the profession of medicine is that it is syndicalistically organized, not syndicates as in crime syndicates, syndicates in that medicine controls the body of knowledge, it controls who enters and who exits. When you start talking about the domain of hospital management and healthcare management, you move into a domain that is much more interdisciplinary, where the body of knowledge is evolving very quickly, and decisions and knowledge are influenced not just by science and by data, but by factors that often are not thought about: politics, process, money, resources, management, law, ethics. Things that are often, as Dr. Connell said, not emphasized on the curriculum of medicine. What I wanted to offer by way of perspective on the importance of doing courses of this nature and doing a course such as this is that the requirements of current and future hospital management or health service management requires physicians to begin to see that additional perspective or to broaden their perspective. And I don't just want to focus on physicians, nurses, people who are coming to this domain from primarily a clinical background. The idea that a hospital also must be understood as a business unit, and that it's clear that we need to be able to understand how decisions are made in such a unit, that unfortunately or fortunately, depending on the perspective, that not all decisions are made just on the basis of, 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 of the patient as a factor. Things such as procurement guidelines, things such as costing and cost benefit analysis. All of you are very familiar with the ongoing debate that is very current about the MRI. A decision being taken by the government or by the hospital to purchase services because it is determined that based on our population size as a country, that we can procure 2 MRIs are sufficient and adequate for a country of this nature. So the decision not to have an MRI in-house at a hospital could be a legitimate decision within the context of how health services are organized. Budgeting and budget management. This is a particular bugbear, I think, for many who are delivering clinical services. Let's use, for example, dialysis care. The cost of dialysis care, we cannot begin to keep up with the costs, and we're having to evolve transparent ways of essentially rationing care. And these are decisions and discussions that are often very difficult to have as clinicians, and recognizing that you're going to have to be making choices, hopefully transparent ones, hopefully where there's a clear governance systems to determine who gets care, when, and how. So the hospital as a business unit is an important dimension that must be understood. And also to be able to evolve an understanding that as we talk about the operations management of a hospital, we're also going to be grappling with the domain of understanding that is not just about patient care and how as physicians we determine what is in the best interest of a patient, but what the patient himself or herself determines also to be in their best interest. In other words, the patient experience. And that marriage and intersection between patient care delivery, determining what is in the clinical best interest of a patient, and how the patient determines and contributes to that active decision making. The ability to communicate, to engage, to empower, and to do so in such a way that the patient experience is enriched by your having so embarked on such a journey. We also are a teaching institution here at the Queen Elizabeth Hospital, and we need to do a lot more research as we're talking about health services management and hospital management. Very often research, even basic rudimentary research, is often thought of as an afterthought. It is my hope that when you embark on courses of this nature, you begin to see the myriad amount of ways, I'm sure Maddie and those in the social sciences and health sciences can share, that we can begin to build research into our decision making. Simple measures like reflective learning, looking at what you've done, deconstructing it, and then proceeding to evolve a new approach based on the learning that we have evolved. It's also important as physicians and clinicians, nurses, team members, to have a deep and fundamental understanding of how health systems work and how health systems are financed and how these influence behavior at the bedside and how they influence decisions on what care to give and who to receive it. The discussion that is constant about the role of public and private practice in our health system becomes something that is better understood in the context of how our health system is organized and compared to other health systems where there are purchaser provider splits, where there's managed care and other mechanisms that allow you to understand how you can deliver. So understanding the system and how it works is also an important dynamic. And I'll close by saying that as physicians, as nurses, we are ultimately in the healthcare team leaders. We're not the only leader, but very often the leadership role of the physician and nurse is very, very pointed. And it is important to understand that distinction between the difference between leadership and management. Sometimes that is not always clearly understood. And courses of this nature allow you to make that distinction, that it is something leadership is about sharing a vision, understanding how to carry people on a journey, how to effect change. That change doesn't occur because people mandate it or say that something has to happen by a particular time, because you have industrial relations, human resource management, and all kinds of factors that go into how you lead, and management being the art of getting things done. So what I want to share with you, that it is important to have the opportunities of a training course to be able to talk to other peers, to explore the kinds of issues that I've started only to highlight here on this call, and to understand that the opportunity to learn in a very structured environment, to explore these initiatives with faculty would be a significant advancement and how we're able to attract people to provide in playing more leadership roles. We need more physician administrators in our healthcare system. I'll stop there.
All right, thank you very much, Mrs. Bynoe-Sutherland. I now invite Dr. Murphy to make her opening comments.
Thank you very much, Marjorie. So I just want to say that the Faculty of Medical Sciences is extremely pleased to be partnering on this program. We've been running a successful Masters in Public Health program now for 12 years, since 2008. And I think this was a natural next move for us in terms of collaboration, and especially given that we have quite a strong module on health systems, which includes healthcare management, course on healthcare management, healthcare systems management, health economics, and those types of courses. And I think what we have found, and especially within our public health program, is that healthcare doesn't exist in a silo, as we well know, and as we as others have expressed already for the evening. But even reflecting on the declaration of Alma Ata, the idea of health for all, even in Health for All, it requires the action of other social and economic factors and sectors to be able to make this happen. So in that, you have the importance of things such as healthcare management. If I reflect on our current pandemic situation, healthcare right now is showing us, I think, a lot of the gaps that we may not have always thought about. We focus a lot sometimes on the frontline workers, on the frontline healthcare workers and the clinicians, but the reality is something is happening in the back to ensure that these processes move smoothly and run smoothly. And what has been most apparent, I guess, in my mind is the need for strong administrative leadership to ensure that our healthcare institutions, and that's not just hospitals, as Juliette mentioned, it's the private clinic, it's private and public, that they're able to continue functioning while still offering a high standard of care, because that's what's important, to make sure we can keep the quality of care at a good standard, at a high standard. And what also became very clear, I think, from our recent experiences is the need for very strong communication and communication skills. And this is something that's quite an art. It doesn't always come naturally to everyone, and there are different types of communication. And I think a lot of times people don't recognize that, there's literacy, and then there's health literacy. There's, sort of communication that we do for marketing, and then there's risk communication, which we've been learning quite a lot about and using quite a lot right now with the current pandemic. So there are lots of things, and nuances that need to be learned, especially by clinicians, in terms of, trying to run an institution, trying to be able to work with teams, trying to be able to reach out to their public. It's quite a lot of moving pieces. And so, as everyone has already said, how healthcare institutions and situations are managed can really affect the quality of care for patients and clients. So this blend of management and public health, I think in some ways people may say, well, what took you all so long? But I don't think it's a matter of taking so long. I think we wanted to make sure as well that we had a solid, good product to give. And I think we're at the point where we have that. And I think it's very clear that the need is there. And I think it's perfectly timed, because I think a lot of healthcare professionals, as we're saying, so the doctors, the nurses, the pharmacists, the allied healthcare providers, that they're recognizing probably now more than ever what gaps may exist in their clinics and their institutions, and the need to apply leadership and management skills in order to fill those gaps. So thank you very much.
All right, and thank you very much, Dr. Murphy. So I think from all four of our panelists, we have heard a very good case for why this program is important, why it is timely, and why it is a need that exists. We have heard some very passionate descriptions of how and where the field is intended to go, where it needs to go in order for us to continue serving really the demands of our nations as we move forward. So perhaps now we can take our conversation along the lines of you talking to our audience about how this program is meeting that need. So who wants to start off telling us a little bit more about the program and how it is meeting that need?
All right, Marjorie, so I will jump in there. Certainly for us at the business school, it's extremely important that the program be a joint program, that it's jointly owned by the School of Business and the Faculty of Medical Sciences, because there are quite a few business schools that have like an MBA healthcare, but it's really the business school's product. They own it. The program ends up being steeped in the business school culture. For us, it's extremely important that this program is almost 50-50 owned by the School of Business and the Faculty of Medical Science. So even at the level of just the design and execution of the program, that blend between medicine and management, we're very careful to have that blend. Also, for us, it's also very important that the medical professionals who are doing these courses, that at the level of their individual courses, so they're doing a course in accounting for decision making, in finance, in strategy, that they are taking those classes with other business students and students from other disciplines. So again, that they are having that conversation around that topic with persons outside of their field. So we see that fusion as especially important. So throughout, so the very design and delivery and management of the program places a strong emphasis on the merging or bringing together of the management as well as the medicine culture. Now, the other thing I wanted to throw out is what are some of the unique aspects of management in the healthcare environment? I know from the leadership end, in some ways, it does resemble a little bit being a manager, like in a university environment. So you're managing a team of doctors. So like when you are a manager at UB, you're managing a bunch of PhDs and professors. So everybody's a prima donna. Everybody is a star boy and a star girl. They've all been high academic achievers. They're teaching their courses. They are the god in their classroom, sage on the stage. And you might have a manager whose H index is not as high as theirs, or they are the up and coming researchers. So I think compared to a lot of other institutions where there is a clear subordinate superior relationship, when you get into some of these service environments like hospitals, like universities and healthcare environments, there are some unique leadership challenges. So you could have a manager who is managing a consultant physician who's making 4 times what he or she makes. Now these create some unique management challenges. And I think one of the more important courses in the program is really a course called Managing Clinical Professionals, which really probes a lot of those types of issues when you are managing professionals who are already stars in their own right, and managing those egos, power differentials. I think those are critical parts, unique that are explored in that course in particular, along with the general leadership. So in terms of how the program will flow, the students will take there's a generic leadership course, which everyone will take. And there will also be this managing clinical professionals, which will sort of take a lot of these concepts and explore in the unique environment of healthcare. And I certainly would like to hear a little bit from some of the participants and the panelists in terms of what they view as some of the unique challenges of managing in the healthcare environment and issues they would like to see teased out in their program. Because I'm assuming that everybody on the webinar is going to sign up for the program.
Naturally, of course.
Can I start?
I've signed up already.
Okay. All right.
Can I start?
Certainly. Is there any way you could speak just a little bit louder? We did have a comment earlier.
Yeah. Can you all hear me better?
A little bit better.
Yes. Thank you. Thank you very much. In the context of QEH, I'll use it so it can be like the reference can be one that's familiar, hopefully, to most people on the call. What is unique when you're talking about management in the context of a hospital in the Caribbean? And dare I say, I've worked at in Trinidad, Bahamas, and Guyana. So it's very similar to other hospitals in other parts, is you're balancing issues of hierarchy, the way that much of medicine and nursing and all of many of the clinical disciplines is there's a value that's placed on experience and experiential learning and knowledge that is critical to how patients are managed. So it is expected that the consultant who has more years is going to have more knowledge than the junior, regardless of how many postgraduate degrees he or she may have. But at the same time, there's also the importance of having that interdisciplinary peer relationship between peers and how that is fostered and created at the institutional level. What are the structures that facilitate this? And also, when you're in a hospital, you are also not just dealing with clinical service providers, you also have ancillary support services. So ask any person who's attempting to do a surgery and recognize that it could be delayed by 2 hours because an orderly is unavailable to bring that patient. So you therefore have to be interested in the logistics of the organization of the orderly service. It's not going to be sufficient to say, why can't they just get the patient on time? The other thing that is important that was alluded to is power. In the context of our health systems, which are publicly financed, very often the decision making about allocation of resources is outside of the institution itself. So Queen Elizabeth Hospital received $116 million. I think we're one of the largest from the consolidated fund. We're expected to function with another 50 million from a health levy. So these are variables that are fixed. There's no additional monies. So when you're dealing within the context of structural adjustment programming, the ability of a hospital to go seeking supplementaries when it is accustomed to people working and producing, and whenever more money is needed or more resources is needed, the administration simply goes and gets additional resources. When you start entering into structural adjustment programs and there's an effort to have more fiscal discipline across state-owned enterprises, you're entering into a domain where your budgets are essentially fixed. And choices therefore have to be made about who gets care sometimes once a budget is expended. And I'll pause by also talking about resource allocation and technology assessment. All of these are important topics that are covered in Fatima, I think, need to mute. Fatima Nana. These are also important variables that have to be factored in how decisions are made, because very often each discipline has an
Hello?
thanks. Each discipline may be coming with a demand. Neurosurgery needs a neurosurgical microscope. Someone else needs another particular type. So decisions have to be made every single day from a management perspective about prioritization and responding to what your epidemiology tells you to be the critical factors, and then also what your patient experience tells you to be the most important factor. So therefore, areas like accident and emergency room, there's always a question across hospital management. Why so much emphasis on A&E when people spend such a short time there and much more time in the inpatient setting? Because it is the front house of your hospital. It's how people judge the institution and its quality. So those are the kinds of issues that you grapple with, just to give you a sample of a few that may be hard to understand if you're a physician providing stroke care, why the investment is going to be made in a new facility for A&E as opposed to a new type of instrumentation to improve the delivery of care to stroke patients. Those kinds of discussions around priority setting.
All right, thank you very much. So I'm hearing there a good response to the question that was posed just now by Professor Robinson, where you were outlining some of the major issues that perhaps are being covered. I don't know if either of the other two panelists want to jump in and really just give us some further insight into the program and into how the program is addressing some of those concerns, or any of the other issues that are really vital at this time for successful healthcare management moving forward.
Sure, Marjorie. So I will jump in to kind of add a clinical perspective, because I see Maddie ready to speak more about the program. But I think part of the issue, and I smiled as the executive chair mentioned the short stay in the emergency room. I think she meant the relatively short stay in the emergency room. But there's the expectation. The public has such a high expectation of the healthcare delivery system. We don't mind waiting an hour or 2 hours to get into a FET, or even in a line of a bank. But if you're waiting half an hour more than you should be waiting in the emergency room, this is a crisis. This is the worst hospital, and all of the other Facebook comments that are made. The public now has a perception, therefore, that there is this perfect hospital out there where everyone kind of slides through gracefully. There's never any kind of hitch up in the system. The expectations are always met. But largely, often when you have a conversation with patients and relatives, you'd realize that some of the expectations cannot be met. And if you have a reasonable conversation, they would actually agree with you. Because as an ill relative, the expectations are extremely high. The other thing which I think is interesting and unique, as Prof was kind of asking, is this is probably one system where non-specialists are likely to be managing specialist services. So you are not the specialist in that area, but you are the manager, this person who is managing. And Fatima Nana is about to get bumped off the island. So it's you're managing the neurosurgeon who knows everything about neurosurgery, who's done all these years in training. I hope there are no neurosurgeons here, but cannot prioritize, for instance, whether there should be 1, 2, 3 MRIs. And here you are coming as a manager and saying, haven't done a day of neurosurgery, what is necessary for this health system, what we can afford, and what is necessary based on data. You must expect there's going to be antagonism. And this is why physicians, nurses, pharmacists, physiotherapists, all healthcare practitioners, there is a language at the management table. We don't realize it because most of us are not speaking it, but there is a language at the management table. And the only way you can be part of that conversation is if you understand the language. If you are coming in with all the medical jargon, which you've been trained to do, then all you can provide at the end of the discussion, I just want it because I'm the neurosurgeon, or I just want it because I'm going to pick on my own specialty. I'm the internist and I manage patients. And when's the last time you were on the ward? In other words, you only see the practitioner or the person who is managing the health system. How can you really be authentically a manager if you haven't been on the ward practicing medicine and their differences? And so I would really close by saying one of the best things that has happened to me in my professional life has been my exposure to international platforms in medicine. The American College of Physicians, for instance, places so much emphasis on the physician as the businessman and the physician as the manager, and how the health system is totally dissected and analyzed in a very critical way, using the health lens, but also using the management lens. And what I would like, if I had more time, Dr. Murphy, is I would really do this course, because to me it adds structure to a landscape that is even more demanding post-COVID. Here's another example quickly. In the post-COVID environment, here we were with this health system, which we knew could not remain the same it was before COVID. But yet healthcare practitioners just knew, well, I have a clinic on this day, I get this amount of staff, we spend this amount of hours. What do you mean I have to change that? And what do you mean you are telling me how to change that? In other words, where does the innovation in health system change occur? We have to be part of that conversation as healthcare providers. So I'm excited, and I will do the program in 2025.
I'm going to hold you to that, Kenneth.
All right. Go ahead, Dr. Murphy. Thank you very much, Dr. Connell.
Thanks a lot. Kenneth will always find space and time for you to do the program. We'll make sure you can get in there by next year. Don't worry. You'll get special dispensation. But you know, you ended on something there that I was actually going to speak a little bit about, and it goes back to my whole spiel on communication, with this idea of language, because it's very true. You're talking about management language, you're talking about medical language, which, you know, we always say, and that's why I talk about health literacy, and I mentioned that because there's so many people who will not understand what clinicians are talking about necessarily. And then there's also the patient language. So, you know, there are many different, you know, people that you have to consider when you're looking at this and trying to understand all the nuances. And there are courses in the program that speak to these things. So Prof would have mentioned some of the business courses, and and the management courses, and the need for this blended approach and this integration of these two areas and making sure that students have the opportunity to mix. And I think that is very important for us, for healthcare professionals to meet different types of managers, and also to learn different styles of management, because they are different styles. And also in being part of the courses that are the health courses, which are run through the public health group in the Faculty of Medical Sciences. You know, you're also going to meet a host of other people within who come in to do public health. And that is a very wide ranging. We've had teachers, we've had, lab technicians, we've had, a whole range of people, not just doctors and nurses, who come into that program. So it lends, for a lot of experiences. It's a graduate program. So the idea is that people are coming in with having some work experience and some knowledge of what they want to do and where they want to go. And because it's a graduate program, it's also an applied program. It's not a regurgitative program. The idea is that, we really want people to learn the theories, learn the underpinnings, learn why things are the way they are, a little bit of the history of how things came to be. And as Kenneth said, you learn these things, you apply them. You also think, how can we be innovative about this? How can we change things? Health systems in the Caribbean may be different than health systems, for example, in the US and in the UK or other places. And are there pieces, when you start learning about different health systems globally, are there different things we can take and give and let go of to tweak what we're doing a little bit better? So, we have courses such as the health economics, as I mentioned. So from an economic perspective, looking at models and techniques to analyze how from individuals to firms to governments, how different agencies make healthcare decisions, and using those analytical tools that they have to, balance that, the increasing demand for healthcare versus limited resources. As we're very well aware, there are limited resources. So how do we work in that environment, and how do we make the best of a situation? When we talk about healthcare systems, we've talked a lot about people, we've talked about finances, but resources are so far reaching. It's about supplies, it's about supply and demand. It's about understanding legal and ethical frameworks, human resources. There are lots of bits and pieces that go into, the management of a healthcare system. And then one of the things I want to touch on is health promotion, because, as managers, I mean, the sort of outcome of what you want is to make sure that you're promoting health and that you're promoting good health and that you have good outcomes. That's the hope. So you want to think about how your office, how your clinic, whether it's private, whether it's public, how your hospital, your institution, how are you practicing and promoting health within your institution? What sort of models are you using that may, work or not work? Because we have to also consider what are the things that don't work for us. You have to consider, the culture of our healthcare and the culture of our people, and the culture of people in other places. And so what does that mean? Because this is not a program, while yes, we're doing it in the Caribbean, and we'll talk about Caribbean healthcare systems and Caribbean healthcare promotion and those kinds of things, and some of the experiences will rely on the students that are in the class and what they bring. The idea is for you all to be global leaders. Anyone who takes this program should be able to go anywhere in the world and be able to apply these principles and learning that they're getting. So really understanding things like public and private partnerships, learning about the different models for healthcare planning. Juliette mentioned things like the needs assessments, monitoring and evaluation of programs, and really understanding your setting. So, there's lots that is being brought together between the management pieces that Justin mentioned, as well as the healthcare pieces that we're going to bring. And I think it's an excellent and really, really strong blend of courses that should address a lot of the gaps and a lot of the issues that both Juliette and Kenneth brought up. So let's hope that everyone, I see 94 participants on here. I'm hoping that all of them plan to sign up for this program.
Absolutely. Thank you very much for your comments and for your response to that question. Now, as we go on, participants, please remember you can feel free to ask your questions, seek any clarification that you require. Just go ahead, type your comments or your questions in the chat, and our panelists will be happy to answer any of those questions. Now, thank you very much for talking about something about the content, and definitely to the other panelists, thank you very much for really thinking about and exploring and sharing where that need or that issue, what is required in order to move healthcare management forward in a significant way. I also like the fact that Dr. Connell mentioned that, for a long time we knew that we had a problem and we knew that change was required, but there was not change happening. And that seems to be a really big thing that has been happening, not just in the healthcare management field, but definitely across the Caribbean. For a long time, we knew that things had to be different, but it really took a crisis for us to somehow find a way miraculously to make it happen. So I'm glad that you were able to mention that, and to talk also about the fact that Caribbean culture is important and has an impact on the program and some aspects, and of course will add its own flavor to the program. So go ahead.
Sorry,
go
I
ahead.
just interject there because I'm looking at the audience and recognizing so many young people, including myself, but so many young people on the call, medical students, junior doctors, nurses, and I couldn't help but at the back of my mind think, well, as a young practitioner, what would I kind of get out of this? Why? Because as certainly doctors in training, I'm sure nurses are the same, you tend to think about choosing a specialty, choosing a subspecialty. I'm going to do my USMLE, I'm going to do which exams. You never think about how am I going to make myself positioned to be a better healthcare leader, or how am I going to make myself a better health manager. And I just want to say that, the health landscape does not stop with a specialty. If I was naive enough to think that the end of my professional domain would end with internal medicine at the bedside, there are some weeks where I don't see patients on a one-on-one basis, and that is satisfying. And there's some weeks where I see only patients, and again that is satisfying. And I think you have to see the medical landscape outside of a hospital, even outside of sick people. What about people who are at risk? What about the social determinants of health? What about making health systems stronger in a small island developing country? These are not irrelevant conversations for you, even at a very early stage of your career. And so after this call, I hope that a lot of our practitioners in training at the various stages will sit back and recalibrate and kind of their whole professional outlook and say, well, yes, I want to complete my DM or my training in whatever subspecialty, but how am I going to change the health landscape? What I'd like to say to the students, how am I going to be disruptive, good disruption, such that the next generation of healthcare practitioners are more innovative, can deal with COVID 2029, knock on wood, or whatever pandemic faces us? How can I be more innovative?
All right. Thank you for jumping in on that. I see that there's a question in the chat. Someone is asking about, is there any focus on health informatics?
So I can jump in very quickly and answer that. So there's not a specific health informatics course, because that is, a field in itself, but definitely within healthcare systems, the use of patient records and the ethics that go along with that, and the use of information technology is something that will be touched on, but it's not an entire course in itself.
Okay, thank you.
In addition to that particular course, there are about 3 other courses that will deal with data. So there's an initial data and information. So there's an initial workshop on business research, which is 100% coursework workshop, where data aspects will be explored. There's also what I think a very important course called Healthcare Quality and Performance Management, which again will also delve into the whole aspect of information, informatics, metrics for measuring the quality and performance within the healthcare sector. And I think, as Maddie mentioned, there is the Computing for Health Enterprise Management course, which is, again, a full 100% coursework course. And that's one of the features also, I think, of the program, where the assessment is heavily weighted towards coursework, which would allow professionals who are working to use the courses and to use these coursework projects to explore issues that they are encountering within their environment. So the actual exam, sit-down exam component of the program is relatively small, because as I go through here, you have 2 compulsory workshops: geopolitics and strategic innovations and business research. They are both 100% coursework. You have leadership in contemporary organizations, which is 100% coursework. Computing for health enterprise management, 100% coursework. Managing clinical professionals, 100% coursework. Healthcare quality and performance management. And at the end, there is a major, an applied research project, which again is 100% coursework. And even most of the other courses, the accounting for decision-making is a 50% exam, and the other 50% coursework. Marketing, 70% coursework. Actually, 100% coursework, my apologies. Primary healthcare, 60% coursework, 40% exam. Healthcare economics, 60% coursework, 40% exam. Effective strategy execution. Again, that's also 100% coursework, apologies, as well as the project management course. So again, the program was really designed in a way that persons have a lot of experience and they are based in a clinical environment. They're going to be exposed to this material, but the assessment is built around using a lot of that knowledge and applying it to problems that persons are encountering in their workspace.
Absolutely. Fantastic to know that.
It might not be something you're encountering, but something you're thinking about, something you actually want to explore, that you can then build an assignment around that.
Okay, we have another question. When is the course expected to start? Is it online or blended?
Okay, so we expect to take in our first cohort of students in January of 2020.
2021?
2021, sorry, it's 2021. I don't know if Ken or Maddie know the exact date as to when our semester 2 begins.
I can't remember the exact.
The answer to that is no.
Okay, but
it's usually the 3rd week of January.
Yeah, somewhere around the 3rd week of January. We welcome you to the Cape. Now, this program is a fully online program. Okay, so it's a program that can be done fully online.
But it's fully online, but I guess we could also say, we can also let people know, I guess, if they are local. I mean, because for example, some of our public health courses, while they'll be fully online, they will still be run face-to-face as well. Because I know there's some people who also like that face-to-face interaction. But also because of the current pandemic, as much as possible, we're trying to reduce that. So it's, quite blended right now. But as you said, Prof, the entire program can be taken fully online for those who are looking for something like that.
Yeah, that's quite an important point, because we are using quite a flexible delivery method. So every course in this program, which I said is fully online, every course in the program has a face-to-face analog. So there's a face-to-face version of every course that is delivered in this program. So persons who want that face-to-face can take that option, or you can access the face-to-face in an online synchronous way. You can tune in online while the physical class is going on, but you can also do it asynchronous, where the materials are set up in that way that you can do it at your own. You don't have to tune into the class physically, because the lectures are all recorded. They are on our e-learning platform. So you really, so technically speaking, if you want, you could do this fully online, asynchronous, online, synchronous, face-to-face, or any combination of that as you move through the program.
All right, thank you very much for that clarification. We have someone who is asking, what are your views on practitioners and their lack of time with patients now being exacerbated by an overload of administrative tasks or non-clinical assignments?
Yeah.
And how can this program rectify that issue?
That sounds like a perfect research project for this program, if you
I
ask
was
me.
about to say.
Yes, I was
Right,
about to
and that
say
sounds
so.
like a really massive job for this program to even be responsible for changing. But do you have any response to that question right now?
But it's so topical now. And in the United States, for instance, there's this whole patients before paper drive by a lot of the professional organizations where burnout rates and satisfaction scores from healthcare providers are on the highest and lowest respectively, simply because we feel that we're spending too much time completing forms, doing administrative tasks and not doing what we're trained to do. And what I think this program actually may do is to show us that we are not only trained to see patients. Administration is part of our engagement in the healthcare landscape. And the more comfortable we are in dealing with admin, for instance, how many doctors set aside, for instance, an admin period where they're only doing administration, not just academics that can afford to put aside, but how many of you are incorporating into your session, your clinical session, whether it's your private practice, an hour or X amount of time to just do administrative stuff? And the reason why we don't like to do it is because we don't feel it's not what we've been trained to do. So I quite like this question. I think this program will allow clinicians to see the landscape in its totality and not just in the seeing a patient by the bedside or via Zoom or wherever you're seeing it.
Yeah. It sounds like there's a real mindset shift that's required here that
Can
may
I also
only come with
add?
time. Please.
Can I also add? Why courses like this also contribute to addressing that issue is, once you start talking about legal risk and risk assessment, what it's going to help demonstrate is sometimes the investment in time in administrative systems really ultimately will help some people basically be able to avoid or better defend situations where they're being alleged to have malpractice cases. So I always say that it is important to not to have too much administration that is counterproductive, but have sufficient that it is both protective of the provider and of the patient in terms of when we have difficulties which ultimately arise every single day in the hospital setting. I also want to add in terms of the professional development. Many years ago, when I was on the Global Fund for AIDS, TB, and Malaria, we were recruiting for persons to run health programs. At that time, it would have been in East Africa, Ethiopia. And I distinctly remember I got involved in interviews for senior level professionals at that time. And sometimes people were coming to those interviews with very strong clinical backgrounds, but they fell down in their ability to communicate with us on project management, on how to manage the resources that they were going to be allocated to efficiently, that we didn't have to worry that they would do something from a procurement perspective that would cause the Global Fund to be in disrepute. So it was clear to me that there was a need back then for some clinical professionals to be much more well-versed in management, procurement, supply chain, project management, and those that were successful in being able to run and manage those huge global projects, setting up hospitals or health systems or introducing, TB and malaria programs, were those that had a very good academic background and work experience that prepared them to be able to have that conversation.
All right,
But
thank you.
also, Chair, I also wanted to add that one thing I wanted to put out there to the professionals is that as a healthcare professional, management is one of your options. It's one of your career paths. Again, if you're concerned about this overload of issues like overload of paperwork and how those things are done, you can use a program like this to rise in the management ranks of the healthcare professional. And if it's a problem, then you can sort it out. I mean, I was dean for 8 years, which effectively I was running the faculty. I wasn't teaching professionally and so on. I mean, I'm quite happy to have moved out of that and going back to being an academic. But in a sense, this can give you the option to move, you know, that most of these management, in a sense, you're a doctor for life or a nurse or something for life, but many of these management posts are contract posts. You can actually go in, do some of this management stuff, get a lot of your ideas implemented, bring in your unique clinical perspectives and so on. And then you can move back into your medical practice having done that. And I think it creates a chance, it's really a new career path. I mean, I don't know how medical experts view management. I mean, I know sometimes that UWI academics, so we sort of view management as, you know, sort of like the plague, you know, everybody wants to stay away from the management functions, and but then they complain when the place isn't well managed. So if you want it to be well managed, then you know, it's a chance for you to step up and actually do it. And you don't have to do it for life. You can do your thing, put some things in place, get what you want, get it shaped in your image or how you want, and then you can move on.
Thank you. We have someone asking about exemptions. Will any consideration be given for exemptions to those who already have completed the MPH degree?
I love when I see our grads asking these questions and wanting to come back to us. So that's great. Thank you, Tara. And yes, there will be consideration because clearly people who have done the MPH, the Masters in Public Health program with us would have taken some of these classes. So there will be the opportunity to look at how exemptions will be given for the ones that you've already taken. And if there are other, for example, elective courses that can be done instead, but there will be options for those courses that have already been done.
Yeah, for sure. We're not going to make you retake anything you've done before, for sure. So, and we will, for people who have done MPH and similar things, we will give you maximum exemptions that we are allowed. I mean, I think one of the issues will be the amount of exemptions with credit we can give you, but there's some rules around that we can't violate, but we certainly will be as flexible as we can in accommodating programs. But we certainly wouldn't let people redo anything. Require persons to redo any courses they've already done.
Okay. And we have someone asking a very technical question with regards to content. They are asking about data. Will the course introduce and spend time on new payment models?
The accounting for decision-making course does cover payment models, particularly in terms of e-payments and different ways. If that's the question that is being asked, the accounting for decision-making course does cover evolution in the payment system. It's not a topic we used to do a lot of because I guess for 30, 40 years, the payment system really didn't change much. You know, you sort of had, okay, we sort of moved from checks to debit cards, credit cards, then you had but certainly within the last 5 years, it's a topic that's come back in a major way in these types of courses as we are at a major pivot point where there is a significant change in payment systems, which warrants it being a topic in a course, but it certainly wasn't a topic that we looked at 5 years ago or 6 years ago, but now in all of these finance courses, it is now an issue because we are at that kind of tipping point where there's a lot of substance and a debate around that.
Yeah. Another question coming in. Is the program equally applicable to both public sector and private sector healthcare providers?
Absolutely. Definitely all the courses that we teach within the public health module of this touch on public and private sector. As I mentioned, for example, in the health promotion course, you know, we even look at public-private partnerships and, you know, different ways, different models of how private and public healthcare systems work and healthcare institutions work. So absolutely, it's as far as we're concerned, this is something that should be quite broad, that allows for both public and private sector.
Okay. Which leads me to a question. If you had to, and this can really be for any of the panelists, who would you say is the ideal candidate for this type of program? Because you may have some people who are thinking perhaps it's only for doctors, and if I'm a nurse or I'm in another part of the healthcare management field, that perhaps it's not really something that I could be interested in. Who would you say would be the ideal candidate or someone who would benefit from taking something like this if they want to go into management? Anyone? If you're speaking, Dr. Connell, your lips are moving, but your mic is not on.
You're muted, Kenneth.
I was trying to avoid the phrase.
I was waiting for a chance to get it.
That's something that most people are look forward to. But I think it's for anyone that's part of the health system. You know, so even for instance, I remember when I was in the UK, we had this long stay patient who he was a physiotherapist, but just for being a patient in a prolonged space, you know, you sit on your bed, you get to observe a lot of things that are inefficient, having some knowledge of the health system. You also kind of say, well, you know, this could have been dealt with differently, or this could, and he actually decided at that point in time to do a program like this. I don't think it was a master's, a diploma or something. So it's for any member of the healthcare delivery team or any member that's involved in management who has an interest in healthcare management. I mean, I do not want this program to be seen as a doctor's program because that would defeat the purpose. And even having a conversation with one of my nurses, hopefully she's on here, I'll give her a shout out just so that I have a nurse tomorrow, Kim Clark Grant. We had this discussion that nurses play such a fundamental role as professionals in the healthcare system that it would be a shame if we were not to see more nurses elevated to a level of decision making and management decision making at the highest levels. And it's not that doctors don't have a unique perspective as well, but I think that removing the nurse's hat from that management table that I was speaking about before would actually do disservice to the conversation, because we all will carry our individual professional biases. And I think that nursing is one of those that should be at that table. So I really want to encourage, especially the nurses, the nursing students, the young nurses who are there wondering, well, I don't know if I want to do ICU. I don't know if I want to do psychiatric nursing or to do midwifery. While you decide, spend a year deciding it, doing the EMBA and PH, and then therefore you have this degree now that once you finish it, whatever specialty you go into, you can be a nurse leader and change the way doctors interface with nurses because it's been aggravating you for all these years, or change the way nurses interface with management because you think that management have it wrong. You can't do that if you're part of management. So you can now change the process.
Okay, all right. Now we have someone here who's pushing back a little and saying that the posted admission requirements almost suggest, however, that the program is poised for doctors and nurses. That seems to be the challenge, that perhaps from what they're seeing in the information that's available, it seems to be just for those two, that segment of the healthcare profession.
And certainly maybe we can take some blame for that. I think and that's why a forum like this is useful, which is also why we thought it was important to actually have this sort of interaction. What we are looking for is familiarity with the healthcare environment.
Yeah.
There are a lot of MBAs in healthcare management, but then you end up with people who just don't have any sense of the healthcare environment coming in as a manager. That's what we are trying to avoid. So that's what we are looking for, is that knowledge, intimacy, familiarity with the healthcare environment, and that we are adding the management expertise to that. And in terms of your ideal candidate, I mean, I'm looking around, I'm seeing some.
You just muted, somehow you just became muted.
Give me the opportunity. You need to unmute.
It wasn't me, that's somebody. I think that was Kenneth muting me as a co-host. Wicked like that. These wicked doctors. Yeah, no, and in terms of your ideal candidate, as I say, I look around, I see some familiar faces and names, well, more names than faces. And I see healthcare professionals who from their public posture utterances have already begun to make that transition from simply being clinical to leaders within the healthcare profession. And in a sense, like this program I see would really help them in making that transition in a fuller way, you know. So it's clear when I look around some of the names, there's some of these medics or doctors I know have become far more than clinicians. They are really engaging the public, engaging the management of institutions. And I think they themselves are, in a sense, they have already by their own choice already begun to make that transition. And they are ideal candidates for this program as they make that transition in a fuller way. Also, process coming up, the research shows that one of the most challenging aspects in the healthcare management are those middle management positions. And there are a lot of these middle management positions. So again, younger persons with that clinical experience or that healthcare experience, that is a career track that they can look at because there are a lot of middle management. I mean, and those are among the most challenging because they are squashed somewhere in the middle there between the top managers and the physicians on the ground.
We have someone expressing an interest in complex adaptive system science and its application to public health. And they want to know whether or not that's going to be a part of the health systems module.
To be honest, I can't remember all of the parts, the modules for the health systems course off the top of my head. But the course subscriptions will be available once, you know, the program is launched and we put all the information for each of the courses online. We can take a look and see if that is part of it. Yeah, so I don't want to say that it is if I'm not 100% sure.
Okay, and someone's asking a question then about actuarial science and stating that some similar international programs also see the importance of integrating actuarial science. Has any consideration been given to such a course as part of the program? Okay, so that can be.
I am on
actuarial science or insurance, understanding health insurance and health markets. I'm just trying to understand.
Okay, well, this person specifically said actuarial science, but then they did say or part thereof. So perhaps that part that you are referencing may be, is that something then that you're saying is already included?
Yeah, Maddie, she's asking really about, you know, health insurance models, you know, how you look at health systems, how some are organized around health insurance and the marketplace.
So I know within the health, I believe in the health economics.
Yeah, the health economics course explores that.
Yeah, they cover some of that.
Okay. The person took the time to say actuarial science specifically. Yes. So, all right. So it's good you answered that is covered.
The answer
to some
is
extent.
No actuarial science explicitly, no.
But to some extent, some of the issues addressed, but not perhaps in the way that person may be requiring. But you did say, with all honesty, Dr. Murphy, that eventually you're going to be putting up the information, and it will provide an opportunity for anyone who wants to have that kind of detail to just go online, look it up, and get a greater sense of the content areas throughout for the program.
Yes.
Could I say something?
Of
many
course.
years ago, when I applied to go to London School of Hygiene, for those of you who are on this call who are not, my background was history and political science, and yet I was applying to one of your leading schools in public health, and they had accepted me. I think it is recognized that people can come at this in terms of answering Justin's question as to who is the ideal candidate. Really, it is someone who is interested in understanding the relationship between medicine, healthcare, and management. And that is applicable in a number of areas. If you have a private clinic and you've just made an investment in a piece of equipment or a surgical suite, and you're trying to better understand how I can achieve efficiencies, how I can market this service nationally or internationally, those people who are interested in understanding the business element of the delivery of health services. Also, people are who are open to changing their mindset. You may not want to necessarily leave your passion, which is the delivery of clinical services, whether it be as a physiotherapist, nurse, physician, but you're trying to understand how administrators like myself think, how the ministries, um, think, how do insurance companies think when they make decisions about what to fund and how to fund it and how much to pay in terms of co-payments. It is important then to understand the healthcare marketplace, those kinds of issues. And lastly, I think the more interdisciplinary professionals, Maddie and Justin, Kenneth, Marjorie, that you can get, particularly into your cohort, the richer the class is likely to be, because it is only in academic spaces that you can sometimes have a safe space for dialogue, a safe space for debate that you otherwise may not have in the workplace, because people, may think you have an agenda, or people may think you're representing a particular interest. So I've found the academic space to be a safe space for exploring, opening your mind, thinking about issues from other perspectives in a way that you're not really confined in how far your imagination can go.
All right, thank you very much. And thank you for saying that, because really I wanted to have that kind of emphasis to really stress that you were not looking for just a particular type of focus in terms of previous study for the individual, but really it has more to do with that attention, that interest, that need, you wanting to fulfill that role. And so once you have that interest in fulfilling that role, then this is a program that you can consider. So thank you very much for saying that.
I also wanted to add, because we were getting some questions about specific courses.
Yes.
And that's a key role of the applied project.
Mm-hmm.
So if there's an aspect of the healthcare system that a person really wants to develop an in-depth knowledge of, they have a particular interest, they would then work on that project, and we would provide a supervisory panel of experts in that area. So again, if someone was interested particularly in that actuarial science element or complex systems and so on, these are issues that they could really build out their expertise in through that applied project.
Okay, nice. So we've been having a rich discussion here, and as always happens when you are having any kind of engaging and passionate discussion, time flies. And so we are drawing nigh to the end of our time that we've allocated for this event. So I would like to give each of you the opportunity just to offer some closing remarks as we get ready to wrap up. And who wants to go first? Okay, we can go in reverse order then. We can start with you, Dr. Murphy.
I was just about to say, I guess that makes it me. I just want to say, thanks to everyone who's come on the webinar this evening. I was really happy to see that there's so many people who are interested in this type of program. At least for us, it means that, we're heading in the right direction. And a lot of the questions that were asked are really great questions in terms of we're already seeing innovation. We're already seeing that you all are thinking ahead of what comes next. And I think that's really great for trying to build a new program, but also in terms of what people will bring to the program. So I really encourage those of you who are asking questions to apply to the program, because you are exactly what we need in it. People who will push the boundaries, who will ask certain questions, who want to see us do more of certain areas that can expand what we're doing within healthcare management in the Caribbean region and beyond. Because as I said, it's one thing to focus on our region, and it's really important for us to have healthcare managers and leaders within the Caribbean region. But there's a whole other world out there where we want to be able to let people explore and be able to go anywhere in the world with a UWI degree and show that, you know, you can hold your own, because it is a very strong degree. So looking forward to seeing some of you in our courses. Thank you.
All right. Thank you very much. Mrs. Bynoe-Sutherland.
Just quickly to say, you know, as a proud UE alumni, I want to really offer Queen Elizabeth Hospital as a partner. Many students will be looking for areas to do their projects and their proposals. We already support the program, the nursing education with opportunities for observerships to take place here at the hospital, just offering the opportunity for people to do as many practicums and initiatives, to have people come out and talk and discuss in real ways some of the issues we're grappling with. So we're offering ourselves as a partnership to really be your guinea pig as you start up this program, to really look critically at ourselves with your students.
All right. Thank you very much. Dr. Connell?
I thought I might have been next. Is my mic muted? Oh, no, it isn't. Okay.
No, it's not.
So I think within the last 24 hours, we've all come across some part of the health system that we wish worked differently, whether it's getting a result from the lab or the way our contract was handled. Regardless of what it is, we saw something that we thought we could change the system. Here is an opportunity for you to have a voice at that table for change. The thing is, you need to speak the language, and that language may not be represented in your professional training as a doctor, a nurse, a physiotherapist, a pharmacist, or any other healthcare practitioner. It's a special type of lexicon involved, and it's a special language, the language of management. And there is no better person to learn that language than a healthcare professional. I want to especially encourage the younger professionals who are excited about choosing a specialty. Choose management as your specialty in healthcare.
All right, thank you very much. Professor Robinson, your closing comments?
You know, healthcare professionals and practitioners are some of the most highly skilled professionals in our society. This program, in my opinion, provides them with an avenue to step out of their specialty and play a leadership role in healthcare institutions and the society in general beyond the provision of healthcare. So I see this as UWI providing to you a vehicle for your own further personal, professional advancement, but along with that, pushing this society as we aim for world-class excellence.
All right, thank you very much, Professor Robinson. And you've heard from our panelists. You've heard information about the program, about the content, about the delivery methodology. You have heard also that you can go online and you can look for additional information about the program. You, of course, can reach out to the Sagicor Cahill School of Business and Management for any additional information or for any clarity that you would like to get. You can also reach out to any of our panelists who are here to seek information or additional clarification on any of the topics that they have addressed this evening. Our panelists have been Professor Justin Robinson, Dr. Kenneth Connell, Dr. Maddie Murphy, and Mrs. Juliette Bynoe-Sutherland. It has been our pleasure to be with you this evening and to provide this information. I am Marjorie Wharton. I was your moderator for this evening, and I totally enjoyed this discussion. As you go on, remember that the application deadline for this program is November 30th. So as you seek your clarification, we are asking you to bear that in mind, get your information together, clarify what you need to, but come on board because we need people like you who are interested in creating the kind of change that is required. So stay safe. Thank you for joining us.